name is Kinley Calloway. I'm a student nurse at the University of South Alabama, and today I'll be performing my IV insertion checkoff. To begin, I would enter the patient's room and verify the order and verify hospital policy. We have an order for insert saline lock in the morning for a CT scan. I will perform hand hygiene and verify my patient using two identifiers. We have Jaguar J. Jones. His date of birth is 8/25/1963. 8/25/1963. He has an allergy to penicillin and an allergy to penicillin. So Mr. Jones, today we are going to be inserting a saline lock IV catheter. It is just going to take a few minutes, and I'm going to provide the patient with privacy. I will position my trash can and perform hand hygiene. I will organize my supplies. I have my IV catheter, my IV start kit, my saline lock, my saline, and now I will take my alcohol prep pad and begin cleaning my saline lock. And then prime my tubing. Let me go ahead and have this all organized. And now I would raise the bed to a working height, lower the side rail, position my patient comfortably in a supine position or sitting position, perform hand hygiene, and don my goggles. And I will apply my tourniquet. And apply my clean gloves, and I will verbalize the three principles for vein selection, which would be the non-dominant arm and the non-dominant extremity, the most distal part of the extremity, and I would choose a soft, large, bouncy vein. And the three principles for vein distension would be to stroke the vein lightly. You can apply warmth to vasodilate for several minutes, or you can have the patient make a fist. And now I will clean my site. Now we'll be doing this in every direction, horizontally, vertically, and in circular motions. And I would do so for 30 seconds. And I would also allow it to dry. I will open my IV catheter. and I would pinch the skin so that it would go 1.5, the vein would be 1.5 to 2 inches. And then I will go in at a 10 to 30 degree angle and extending, and then observe for blood return. Once blood return has been reached, I would extend the catheter 1/4 of an inch, and then extend up all the way down to the silent. And stabilizing this with one hand, moving the tourniquet with another, and applying gentle pressure at the site and disposing. And then I will now take my saline, maintaining sterility, remove the cap, quickly attaching it, and then aspirate for blood return, and then flush the vein with saline. Oh. I'm sorry, the pool noodle is not meant to flush, so normally that wouldn't happen. So I'm going to paralyze the vein being flushed and remove my tubing and allowing it to assume a natural position. I'm sorry, the pool noodle is very unreliable. And now I will take my tape and then also attach my transparent film dressing. Alright, and I would then clean up my supplies. Alright, so I will clean up my supplies, dispose of them properly. And I will remove my goggles, remove my gloves, remove my goggles, and I would position the patient comfortably, raise the side rail, lower the bed to a working height, or to lower the bed to the lowest position, and perform hand hygiene. I would teach the patient how to avoid dislodging the IV and the signs and symptoms of inflammation, phlebitis, and Missing one. I'm not sure. I feel like I'm missing one, but I might not be. So then I would, after I've positioned the patient comfortably and performed hand hygiene, I would leave the room to document. I would document the size, type, and length of the IV catheter, the location of insertion, the if there were any fluids given, and the type and rate at which those were going, or the presence of a saline lock, the number of attempts, and how the patient tolerated the procedure. So after that is done, I will now demonstrate how to discontinue the use of an IV catheter. For this, I will need clean gloves, goggles, and I have gauze. So I will apply my clean gloves. All right, and now I will begin by removing, I would like to verbalize this. I chose not to add the tape for the date, time, location, and initials for the insertion of the IV catheter, but I would normally do that, and I had some trouble in previous attempts trying to write on my tape, but I would normally do that. Now I will remove the tegaderm going at the direction towards the catheter hub. I would have my gauze. I'm applying gentle pressure and remove the catheter gently and slowly. Assess it for intactness and assess the site for, that would normally go up the end, and assess the site for any inflammation, pain, redness. I would hold the gauze down for 30 seconds to stop the blood, stop bleeding, and then I will tape it to secure, and I will now remove my goggles, gloves and goggles, and I would assess how my patient tolerated the procedure. I would document the removal of the catheter, position the patient comfortably, lower the bed, raise the side rail, and that concludes my checkoff. Thank you.